Coming up today, quick thinking 30,000 feet in the air. How doctors on the ground removed this from a passenger's brain after an emergency landing in Kansas City. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. A routine flight across country took a scary turn for a Seattle man and many on board who ultimately helped save his life. Here's Kelly Taylor.
Flashing a thumbs up, Christopher Schwab signaled he's recovering well after he suffered a stroke mid-flight just 4 days earlier.
I just felt like my whole left side of my body was really numb. So I decided to use the restroom and splash some water on my face. As soon as I stood up and started walking, I collapsed the walkway of the plane.
The clock was ticking to get Christopher the help he needed quickly, so his flight was rerouted to Kansas City.
I was very lucky that there were 2 physicians on the flight back home to Seattle.
Christopher's wife, Edie, would soon receive the news about his condition, and it came as a shock to her because he'd just run a 5K 2 weeks earlier.
I just immediately, my whole body just like paused, and I didn't know what, I was like hearing that from a doctor. I'm like, how does he have a stroke? Like, he's 40 years old.
Back in Kansas City, doctors at an ER in the Northland started early therapy with clot-busting medicine before transferring him to the University of Kansas Health System for a procedure to reverse the stroke.
That was what we had to pull out of there.
Dr. Koji Ebersol is the director of endovascular neurosurgery at the health system. He performed Christopher's procedure.
He had an injury to the carotid artery in the neck, which is something that can happen as a freak occurrence even in young people. So we needed to repair that to understand what was going on with the brain, and it turns out that there was a large blood clot that had obstructed the major blood vessel in the brain.
Dr. Koji Ebersol extracted the blood clot and completely restored blood flow, giving Christopher's brain an opportunity to recover.
Can I give you a hug for saving my husband's life?
Christopher regained much of his strength, even with some visible signs of stroke lingering.
You got it.
All right, no showing off.
Well, he did 2,000 steps yesterday.
Whoa.
Around the hallway.
That's something his family, friends, and fellow online supporters prayed for.
All of those messages, when we posted them on Facebook, that was what helped him really go through his treatment and go through.
Motivated me. Just knowing there's a lot of people who wants me to come back home. It's helped me a lot.
And Christopher Schwab and his wife Edie are joining us from their home in Seattle this morning. We're also joined here by Dr. Koji Ebersol, the neurosurgeon who removed the clot from Chris's brain. Dr. Ebersol is also the director of endovascular neurosurgery here at the health system. Always good to see your patients.
Oh, yeah, no, you guys always get me with these stories.
Every time. It is emotional for you.
Absolutely.
To see this all come full circle.
Yeah, it was fantastic.
So, Chris, we saw that emotion there in the piece. Could you, just before we get started, tell us a little bit more about those feelings that you remember?
Yeah, to be honest with you, I don't remember much of it, but just seeing it again is making me emotional as well. And just so grateful for everything that you've done for us in Kansas City, and Dr. Ebersol. Thank you so much. We're truly grateful for all of you.
So this happened over this summer. How are you doing now?
I'm doing a lot better. I've been able to keep up my physical activity. While I was in the hospital, I was praying. I was like, please just let me walk again. I prayed every day. And so right now, over the last 2 months, I've been able to run at least a total of 36 miles on the treadmill. And so I count that as a blessing. So I do it every day. So it's been a good recovery. We've been really lucky,
So any signs of stroke from before? We saw in the video that we could see that visually, but any signs now at all?
From what I hear from my friends and family, they don't really notice it anymore. I noticed a little bit, the left side's still kind of slow, but nothing like it was even just a month ago,
What kind of?
I guess that's more of a question for my wife. She sees me in that perspective, so.
I think we're pretty close to a full recovery. I'd say like even the face, like seeing that video, because we haven't seen it in so long,
Yeah.
I'm like, oh wow, what a difference how you look today versus then.
Yeah.
I mean, it's night and day.
I bet, Edie,
Yeah.
because you're watching it day to day. So what kind of physical, have you done physical therapy, speech therapy, Chris?
Yeah, I've kind of done it all, right? So I did occupational, speech, and physical therapy over here at the Good Sam Hospital here in Puyallup, and that team has been really incremental in making sure that I've been able to recover as well as I have. I've been able to graduate from kind of all of those therapies already, so I have been also released to full-time back to work, which is great. I'm really excited for that.
Yeah.
I bet.
So I have a lot of support back here at home. So
Trying to get back to the normal. So
Yeah.
the doctors and passengers on that flight, they helped make that call to land the plane because you needed emergent help. But tell us a little bit more about what you remember in those moments.
All I know is just kind of this rush of emotion just because of the unknown. I didn't really know what was going on, you know. All I remember was just people surrounding me and really just taking care of me. So I just
And then
wanted-
Edie, you hear about this, you jump on a plane for Kansas City. What was that communication like with his care team? You're traveling. I'm just trying to, it seems very dramatic. You trying to get these updates. What did that look like for you?
It was pretty nerve-wracking and scary, to be honest, because I was waiting. When I got the phone call from the people that helped him on the plane, they didn't really tell me that he had a stroke because they couldn't confirm it until he went to the hospital. So it's when he went to that first hospital that the doctor told me that he had a pretty large stroke. And I'm like, what? How? What's happening right now? You know, he was just on his way back from a work trip. I know he just ran a 5K. The stroke was literally the last thing on my mind, and I thought it was a hoax. I was like, are you sure my husband's having had a stroke like Christopher Schwab, right? So, but I immediately hopped on a plane with his mom with the help of my sister. She put us on a plane to go to Kansas City. And I just try to remain as calm as possible and just pray that when I get there, he's okay. And it turned out by the time I got there, brain surgery and everything was done. So I was so thankful that by the time I got there, I didn't have to, I was on the plane, but worried sick about him. But when I got there, seeing that he's in recovery and surgery was successful, I was just
you landed and
with
got some good news. But I love what you mentioned. You're like, I thought it was a hoax, because I'm thinking, is that really my husband? He's 40 years old. He's healthy. I want to bring in Dr. Ebersol because he's not the typical stroke patient that we think of. We know stroke can happen at any age, but it's a little unusual when we heard this story, right?
Oh, absolutely. Stroke is definitely a disease process that's related to chronic conditions most of the time, things that take decades to add up. Cholesterol, diabetes, years of smoking, those things tend to be affecting the older population. But young people can still have strokes, and it can be life-changing. I think the timeliness of everybody's action for Christopher's story is what made it a positive outcome.
So when did you first hear about Chris, that he was coming here?
We must have gotten notified from the outside hospital that made the diagnosis of stroke, and then they contacted KU, and KU has the highest certification for stroke management, and so immediately the signals get sent out to everybody involved in the team, myself included. But there's multiple personnel that are all notified at a moment's notice and all regrouping at the hospital to help solve the problem.
And you're trying to kind of plan, I would imagine, and you've told us this, when you know someone's coming over here, you're trying to kind of make that plan of action so that when he gets here, the team can orchestrate and get him better, right?
True. You want everybody working at their top speed, especially when you hear that it's a young person. It just puts you in a different gear. You know that if you can restore blood flow, that a young person's brain has a better opportunity to make full recovery compared to somebody who's already had multiple decades of life behind them. So we were all in top gear.
So time is crucial. We always say that's just minutes, seconds
Absolutely.
can matter. How important was it that there were physicians on the plane? Tell us a little bit about that.
To me, that's a
it has to
huge
help.
part of the story. How lucky can it be that you have such an emergency event and it's immediately recognized that it's so important that the plane is diverted from an East Coast to West Coast flight halfway across the United States, that there were people on the plane saying, this is severe enough that you need to land this right now. That's a big deal.
And was Chris on medication when he came here? And if so,
I do not recall.
Chris, do you remember anything about that? Were you on a medication when you came here or given something at that outside hospital?
No, I wasn't on any medication prior to the stroke.
Nothing at all.
Nothing
yeah.
at
A
all.
clot busting drug? Was there anything that was used
Well,
in
they
those
did
moments?
administer the clot busting.
Well, yeah, I think they gave me a clot busting drug as soon as I landed.
And that's pretty standard with that, if
Yes,
possible.
if you identify the stroke early enough, a patient can be a candidate for a clot-busting medicine, which has a chance of improving outcome. The trouble is, if you have a large occlusion in the blood vessel, that clot-busting medicine cannot act fast enough to restore brain function.
So what was your biggest concern with this clot? When you get to him, you know, on a scale, how urgent is this?
Oh, this is as urgent as it gets.
Okay.
Every passing minute, you're losing neurons, the functional element of the brain. We need to get oxygen back to the brain. The major technical challenge was that he had more than one area of active pathology. The blood vessel in the neck was injured, and we needed to open that blood vessel to even get access to the blood vessel in the brain where the obstruction was. So we had to fix 2 sites in a timely manner.
All right, let's show it again, because this is the picture of the clot that was removed.
Oh, sure.
Just give us a little perspective, how large this is, how concerning this particular one was.
Okay. The blood vessel in the brain that supplies the majority of the hemisphere, meaning half of your brain, is about the diameter of a spaghetti noodle. So this blood clot is about the diameter of a spaghetti noodle, maybe 2 inches long. That thing was obstructing the blood flow in the vessel. There's no way the clot-busting medicine can eat through that much clot. It needed to be physically extracted, and that's what our instruments were able to do.
So tell us a little bit more, again, about the exact procedure you did, and were there any other options, or was this you knew immediately this was it?
This is it. If something was going to work, it was going to be this. It's a catheter-based treatment, which means catheters are these long, flexible tubes. You start the access in a blood vessel next to the hip, and you track the blood vessel, the catheter through the blood vessels up to the neck, and then at the level of the neck, we had to apply a repair. We used a balloon to open the blood vessel there, and then the key was taking a finer catheter into the blood vessel of the brain and essentially aspirating, meaning using a vacuum type pump to suction that clot out in one whole piece through the catheter system out of the body.
I love how you use your descriptions. It helps us kind of understand exactly, you know, what's being pulled out and sucked out. So I appreciate that. All in a day for you. But Chris, recovery is next, of course, and you ran a 5K. Is that what I understand? After this happened?
Yeah, actually, a couple of weeks before I went back to work, wife took me out to Hawaii for a just like a reset before I go back to work, and so we ran a 5K out there with our insurance company that we manage, and it was good. It was a good experience, and so it gave me a lot of confidence that things are going back to normal. So.
Yeah, Edie, how about you? How did that feel to see him back out there?
Honestly, his recovery has been a miracle and so phenomenal to watch. And people have told me numerous times that people who've had a stroke don't recover as well as he has, especially at the amount of time that he's recovered. So we're just very blessed and thankful that everybody on that plane helped with his recovery. Everybody at the hospital with their fast action helped with his recovery. And it's just, everything seemed so orchestrated that it was almost as if that's why we do these interviews with you guys, because we wanted to inspire other people so that they can see that with quick action, this is, you know, what literally can happen. It's like you can get, I was worried that he wasn't going to be his full self because I've seen a lot of people tell me, okay, but just watching him, I'm like, I think he's better. I mean, he's running more than me. He's working out more than me. He's doing more than me. So he's just trying to beat the odds, basically.
Is he doing that right, Dr. Ebersol? Getting back to exercise, no concerns there?
Absolutely. Those are all the things that you want to do.
He's being a good patient.
Oh, for sure. That's
so are you
perfect.
surprised at all of his recovery timeline? Is this what, of course, you would have hoped to have seen, but it doesn't happen like this for everyone, I would imagine. Is this pretty typical or not?
This is exactly why we do these things, and with the speed and acuity that we do them, because this type of outcome is possible. For sure, it represents everything going exactly right. But that's possible with a network that's set up for timely action and understanding on the patient's part that this is an emergency and them taking timely action. If you put those things together, you can have outstanding outcome.
When I was hearing this story, guys, I was just like thinking of it, Chris, an entire aircraft. You hear this on a movie, an entire aircraft turned around just to try to save your life. What is that like for you? Just to kind of have that be part of your story.
It's kind of crazy to think about, sorry.
No, take your time.
No, it's okay. It's literally a scene from a movie to me, at least. I mean, we met the flight attendant, she was amazing, and the captain of the plane who also reached out to us. And she had mentioned to us that, she's been with Alaska for over 24 years, and she's a senior flight attendant, and never in her career did they have to divert a whole plane. It's not something that happens every day. It's such a tough call to make, and it was just, time was on his side, God was on his side, because if he had landed, maybe they were trying to land at St. Louis, Missouri, but they didn't have the clearance to land there. Luckily, the next airport was Kansas City, and luckily Dr. Ebersol was there, because we don't know what the results would have been if we had landed in St. Louis. We don't know if they had access to that type of technology or medicine and all of that stuff.
Yeah.
So it felt like I was in a movie.
It's like, exactly. Well, the story, it plays out like you literally landed in the hands of Dr. Ebersol. And when you say that you're going to remember all of these people over the years, guys, I know Dr. Ebersol, and I'll let you speak. You remember these stories and these patients the way they remember you.
Oh, sure. Yeah, it's a big deal to know that all of these efforts that we're making can have such a positive impact on somebody's life. I mean, that was a life-changing event there, and we turned it back the way that we wanted it to go.
Yep, one for the books. Okay, be sure to ask your questions. Use the chat on YouTube or Facebook. You can tweet us or email us at the Medical News Network. Info is right there on your screen. Let's check in with Dr. Dana Hackinson, Medical Director of Infection Prevention and Control. Good morning.
Yeah, hi.
Hi.
What a segue into that, right?
Cool, cool story. Good
very
outcome.
Cool. The miracles of new medical science and research are very outstanding. So, now segueing into COVID infections, we have 19 active infections in the health system this week. So just up a little bit, and we'll wait to see what that trend is as we continue in this winter season and this respiratory viral season.
Yep, that's right. Virus season, cold, flu, COVID, you name it. Hawk, you've seen some research recently suggesting that cold air actually has a direct impact on our immune system, at least the immune system in our nose. Explain more about that.
Yeah, so this was a basic science study which was published a year ago, so December of 2022. And we know that there can be seasonal variability in illness, particularly respiratory viral illness, such as the common cough and cold, influenza, etc. And we know that this variability is due to a combination now, not just one thing or another, but a combination of behavioral changes, things like being close together with people because of parties or get-togethers, because of the cold weather itself, but also behavioral things like continued poor hand hygiene and touching your hands to your face, your eyes, your nose, your mouth. But there's also environmental changes, as we just talked about, such as the cooler temperatures. So this was a pretty good basic study, basic science study, really, which looked at, in a laboratory, looked at nasal mucosa tissue or cells, but also just nasal cells, which were grown all in culture. And what they did was look at what happens when there's a decrease in temperature with those cells and some of those protective components that they secrete to help protect us against viral infection. And what they found that the colder temperatures did in fact reduce or mitigate or modify some of those protective protections and factors that were released from the nasal tissue cell. So overall, it is very interesting. It is one step closer to elucidating this very complex way that our immune system works, particularly our inherent or innate immune system in our nasal passages. But I think we do need to remember it is complex. It's not just one thing or another. It's not just black and white, because we also do see a continued amount of seasonal respiratory illness, even in those warmer temperatures or those equatorial regions as well. But I think this is one step closer to now maybe finding ways to help modify and decrease our risk when we do come into this respiratory viral season.
All right, Hawk, thanks so much.
Yeah.
Let's get to some questions from our viewers today. Dr. Ebersol, do we know what caused this stroke?
Yeah, there was an injury to the blood vessel in the neck. The question is, what caused the injury to the blood vessel in the neck? That can happen from significant twisting of the neck, which can happen by a bike accident or a motor vehicle accident, but sometimes even a freak occurrence can lead to a small injury that over time, as the body's trying to repair it, it's in a way making an internal scab, and it's the scab itself that can break off of the blood vessel, travel into the brain, and obstruct a major vessel supplying the brain. That was the cause.
Shannon wants to know, what are the odds of Chris having a second stroke? Does one mean you're at higher odds for another?
I think that for him it was a freak occurrence, and I think he's going to be safe for years to come. I think importantly, as he starts aging into the population that's more typically getting strokes from more common mechanisms, the same attention that he's applying to his health will need to be applied at those times, making sure that he's eating well and he's following the advice of his doctors to control blood pressure, diabetes, or cholesterol, any of these conditions that can add up over time to narrowing of your blood vessels.
Jennifer wants to know, of course, we talk about time is of the essence when we're having a stroke, but what would have happened possibly if that plane couldn't have landed in time?
Almost certainly, if the flight continued to Seattle, the window of time would have been lost, and the absence of blood supply to the brain would have led to irreversible injury. And you saw in the video that Charles's face was not symmetric, and I'm not sure if he was able to show his movement, but the left side was importantly weak. If they waited until he got to the West Coast, this would have been permanent and probably total loss of movement of the left side of the body for the rest of his life.
Chris, when you hear that, what do you think?
Oh, it's so scary when I hear about that, and that's always my fears too, right? Like if things wouldn't have happened the way it did, like what would the outcome would have been? And it's terrifying even thinking about it. But yeah, thank you so much for taking care of me so quickly. You know, it's a God bless you guys. Seriously, it really has made a difference in our lives. So I couldn't ask for a better outcome, at this point. So.
We're so glad you're doing good. Question, does being up in an airplane, I know it's pressurized, but is being up in an airplane, would that put you at a higher risk of having a stroke or some sort of event?
I think of the mechanism that we're talking about, there's not a relationship. But if you read the pamphlet on the airplane and you're on a longer flight, it will advise you to be up and walking around. And part of that is because if you're not moving your muscles, especially the muscles of the legs, you can build a blood clot inside of the vessels in the legs. And depending on your anatomy, it's possible for that blood clot to travel to an important area, the lungs, possibly even the brain. So in that way, there may be a relationship. So be active on the plane if it's a longer flight, and be well hydrated.
Good tip. Jean wants to know, does Dr. Ebersol repair aneurysms pre-stroke?
Yes, that is one of my favorite things to do.
It is. That's one of your favorite things to do. Tell us more about that.
Well, an aneurysm is something that can affect the full gamut of the population, from a baby to a grandma. It is something that develops most often silently inside of the brain, and the patient is unaware that they're harboring this thing, but it represents a weakness of the blood vessel wall, and you can have a sudden emergency in somebody who's perfectly healthy because the weakness in the wall became exceeded and you had emergency bleeding on the brain. So the goal of aneurysm management is to identify patients with these abnormalities before they get the trouble, because if you experience bleeding from an aneurysm, the odds are heavily stacked against you to go back to a normal life.
Yeah, that must be a high for you to divert a stroke.
Oh, yeah, sure.
Absolutely. Okay, so question from Yen is, what could patients do before seeing a doctor if you have a stroke or a blood clot? So I don't know if that's like pre-care. Try to understand that question. What could patients do before seeing a doctor if you're having a stroke? Is it, if you haven't gotten to a doctor in time, are you popping an aspirin? Are you, is there anything to do kind of to self-care in that time?
Oh, is the question if they think they're having a stroke, should they do anything before they reach medical attention?
I think so, but let's answer that. I'm not, I'm not sure, but
to
I like
me,
that.
if you think you're having a stroke, 911 is the answer. It is not uncommon that I encounter a patient that they felt like they were having some early symptoms, numbness, for example, that came on suddenly involving half of the body. And they said, that's a little weird. Maybe I was sitting strange on the couch, and they were thinking, maybe I should try to sleep this off. And then when they wake up, the problem is much more significant. If you have a sudden change of neurologic function, you should call 911 and let the medical professionals vet it. Don't try to evaluate this yourself. The mnemonic is FAST. If you have face weakness, arm weakness, trouble with your speech, and it happens suddenly, time is of the essence.
Can't nail that down enough. What about aspirin? Is that a go-to still?
I would not recommend to, if you think you're having a problem, to take an aspirin in hopes that that's preventative, because you don't know what is causing the problem.
What about taking an aspirin and calling 911?
No, I
just
cannot.
call 911.
Yes, exactly. Because it may be that the reason that you have this sudden change in neurologic function is actually a bleeding event in the brain, and you could exacerbate that by aspirin. So the first test that you'll get at the hospital with stroke-like symptoms is a CAT scan of the brain to see, is it an obstruction or is it a bleed? Okay, so even the medical professional will not know without getting that CAT scan. And aspirin is definitely not helpful in one of those two possibilities.
But I think people think that. Keep that in the purse. If someone I know is having one, they'll pop an aspirin. So I have to ask this because now I'm curious. In what case would you pop an aspirin? Is that out the door? We don't do that
I would not do that.
Okay, that's done.
I would not do that.
Okay, thank you. Okay, good tip. All right, I want to get our takeaways today. Dr. Ebersol, I'm going to start with you. Someone listening right now, what is the takeaway today?
That stroke can happen to anybody, no matter your age, and you want to recognize the signs and be timely about this. Again, the mnemonic is FAST, face, arm, speech. Time is of the essence. And that even if you experience a stroke, if you have trust in your doctors and they have a good infrastructure, you can make important strides over time. And there's no limit to how far you can go. The brain keeps improving function over time. Yes, it might be a longer and protracted course if the injury was more significant, but the more effort you apply, the better you can do with the function that persists. And doing the right things, just like Christopher has done. If you're going to go through an event like this, you can't suddenly become a couch potato. You've got to live a full life. That's an outstanding lesson that he's showed all of us.
I was just going to say, great lesson from you today. Always good to have you, Dr. Ebersol. Thank you so much. Edie, Christopher, again, thank you for being with us today and just sharing your story. We're so glad, Chris, you're doing well. I want to hear from both of you. What is the takeaway from your story?
Yeah, I want to piggyback a little bit of what Dr. Ebersol said. Is you know, it was such a success in the reaction of how it was treated. But I think one of the reasons I was able to recover so quickly was that being proactive, you know, prior to the stroke, you know, having some different healthy lifestyles that even previously I probably didn't do. But I think that you know, changing your lifestyle so that these type of events, when they do occur, your body is more prepared, you know. So.
Edie, what's the takeaway?
Honestly, the takeaway, in addition to what Chris was saying, I think we had this conversation with Dr. Ebersol because I asked him if his health was a huge contribution to how he's recovering, or if he would have had the stroke when he was 260, 70 pounds, if the damages would be different. And he said absolutely. The biggest takeaway here is definitely our health is our wealth. Also, on top of living this whole nightmare scenario, being properly prepared for the worst, because this could have turned out in a whole different aspect for us. But since we had insurance that covered stroke, he was able to stay at home. I was able to stay at home and help him recover, because I hear a lot of people who've gone through something traumatic as what he went through, but the outcome for them and the financial aspect of what they have to go through is not what we went through, because we went through at it as ease, so properly planning, but also taking care of our health and wealth and combining both. I mean, this is the outcome that you would get.
Edie, great message. We appreciate you wrapping us up today. And again, thank you both for being with us. And we do want to leave you with this reminder. Dr. Ebersol spoke about it, but we're gonna drive it home. Stroke is a condition that you can recognize, and if you do it, you can act fast. Remember the acronym BFAST. It stands for balance, eyes, face, arms, speech, and of course, time. If your face is drooping, your arm is weak, you are not speaking clearly or understanding clearly, this may be a stroke. And again, time of the essence. Call 911 immediately, as Dr. Ebersol said. Thank you again to all of our guests and to our viewers for being with us today. We'll see you back here tomorrow.
Coming up Wednesday on Open Mics with Dr. Stites. How accurately can science predict who will get dementia? And what should someone even do with that information? I'm Alexis Del Cid. On the next Open Mics with Dr. Stites, the blurry line between normal aging and cognitive impairment. We show you the science. Wednesday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.